So I'm Vaishali Sanchorawala from Boston University Amyloidosis Center, and we will be presenting our abstract on Waldenström's macroglobulinemia-associated AL amyloidosis, clinical characteristics, treatment, and survival outcomes at this meeting. We identified 49 consecutive patients with Waldenström's macroglobulinemia-associated AL amyloidosis evaluated at the Boston University Amyloidosis Center. All patients met clinical pathological criteria for Waldenström's macroglobulinemia and had positive Congo red staining of a biopsy specimen with typing confirming AL amyloidosis. AL amyloidosis was diagnosed after the diagnosis of Waldenström's in 80% of the patients, with a median time to diagnosis of 3 months, ranging from 2 months to 201 months. 31 patients were diagnosed with AL amyloidosis more than 5 years after the diagnosis of Waldenström's macroglobulinemia. Renal involvement with AL amyloidosis occurred in about 50% of patients, cardiac involvement in 35% of patients, and lymph node involvement in approximately 15% of patients. Of note, 80% of patients had MYD88 mutation, and 30% had CXCR4 mutation. It is also important to note that no patient with WM-AL amyloidosis harbored translocation 1114, which is commonly associated with AL amyloidosis. Hematologic complete response and very good partial hematologic response occurred in 50% of the patients. Moreover, patients with hematologic VGPR and CR had significantly higher organ response rates. Median event-free survival was 4.9 years, and median overall survival was 7.3 years from the time of diagnosis of WM-AL. Of 49 patients, 15 were treated with R-bendamustine, 9 with BDR, and 9 with high-dose melphalan and autologous stem cell transplantation. We conclude in this abstract that standard Waldenström's macroglobulinemia treatment regimens are effective in WM-AL amyloidosis patients. Moreover, frontline high-dose melphalan and stem cell transplant induces deep and durable responses in highly selected patients with WM-AL. Waldenström's macroglobulinemia patients require monitoring for red flag symptoms of AL amyloidosis throughout the entire disease course, as patients can be diagnosed with AL amyloidosis even 10 years after the diagnosis of Waldenström's macroglobulinemia. So it is critical to have a multidisciplinary and interdisciplinary team approach to these patients because of multi-organ dysfunction, as well as presence of neuropathy, as well as presence of nephrotic syndrome and presence of congestive heart failure or cardiomyopathy.